In this video, here's what we'll cover. What burnout actually is. The 3 dimensions of burnout. Why burnout happens at work. Burnout or depression. Evidence-based ways to recover. It is Sunday afternoon, and you can already feel Monday arriving in your chest. The laptop is still shut, nothing has happened yet, but your mind is running through the meetings, the unanswered emails, and the project that keeps slipping. You used to like this job, lately you dread it. For months you may have told yourself it was just tiredness, and that a good weekend would sort it out. Then the weekend stopped sorting it out. You wake up drained before the day begins, you snap at the people you care about most, and you quietly wonder whether you are still any good at work you once did with ease. If that sounds like you, I want to say something clearly. You are not weak, and you are not failing. This pattern has a name. It is workplace burnout, and I see it often in my practice here in the Hills District. Let me start with what burnout actually is. The World Health Organization, or WHO, includes burnout in the 11th edition of the International Classification of Diseases. The WHO describes it as a syndrome resulting from chronic workplace stress that has not been successfully managed. 2 things there matter. First, burnout is an occupational phenomenon. It is tied to work, and the WHO is clear it should not be used to describe other areas of life. Second, burnout is not classified as a medical condition or a mental illness. It sits in the part of the classification covering factors that influence health, not the section for diseases. So why take it seriously if it is not a diagnosis? Because it still affects your health, your mood, your relationships, and your work. And because the things that cause it can be understood and changed. Ordinary stress comes and goes, and most of us bounce back after a rest. Burnout is what can happen when the stress never lets up, and there is no real chance to recover. Over time, the well runs dry. The WHO definition names 3 dimensions, matching the model built up over decades by the researchers Christina Maslach and Michael Leiter. The first is exhaustion. You feel drained, physically and emotionally, and rest does not seem to refill the tank. The second is cynicism, or mental distance from the job. Work that once felt meaningful starts to feel pointless. You pull back, go through the motions, or become irritable and detached from the people around you. The third is reduced professional efficacy, a sense that you are no longer doing your job well, or that your efforts do not matter. Tasks that were once easy feel hard, and confidence drops even when your performance has barely changed. Burnout is rarely just one of those. It is the combination, building slowly. Recognizing all 3 in yourself can be the first step toward taking it seriously, rather than pushing through. Now, why does it happen? Here is one of the most important points. Burnout is not simply a personal failing. It is not caused by being weak, lazy, or unable to cope. The research points strongly to the conditions of work itself. In Australia, Work Health and Safety Law now recognises this. Safe Work Australia's Model Code of Practice defines psychosocial hazards as anything in the design or management of work, the working environment, or workplace behaviour that may cause psychological harm. Safe Work NSW lists hazards that can drive stress and burnout. High job demands, like heavy workloads and unrealistic deadlines. Low job control, where you have little say over how or when work gets done. Poor support from managers or colleagues. Unclear or conflicting expectations. Effort that goes unrecognized. And conflict, incivility, or bullying. Maslach and Leiter describe burnout as a mismatch between person and job across 6 areas: workload, control, reward, community, fairness, and values. That is why recovery is rarely just about the individual. People often ask me how burnout differs from depression. They share symptoms, including exhaustion, low motivation, poor concentration, and irritability, and research shows they overlap a great deal. The practical difference is usually this: burnout is anchored in work, so when you are away from the source of stress for long enough, the cloud often starts to lift. Depression tends to color everything, including home, hobbies, and relationships, and may not ease by stepping back from the job. That distinction shapes the right support, and a careful assessment helps sort one from the other. If you notice low mood that does not lift, or thoughts that life is not worth living, please treat that as a reason to seek help promptly. The encouraging part is that burnout can be turned around, and recovery tends to work when it addresses both the personal and the practical. Restoring boundaries and genuine rest comes first. Protect your time off, sleep, movement, and switching off after hours. Saying no and setting limits is not selfish. It is how the tank refills. CBT can help you notice and soften the rigid rules that keep you pushing past empty, like the belief that resting means slacking. ACT can help you step back from self-critical thoughts and take small steps back toward what genuinely matters. And because burnout is driven by work conditions, lasting recovery often needs change at work too, whether that is a more realistic workload, clearer roles, or better support. If any of this sounds like your life right now, help is available, and burnout is genuinely recoverable. At Potentialz Unlimited in Bella Vista, we take it seriously and work with you on both sides of it. You can read the full guide, or book an appointment, using the links in the description below. Before you go, here's a quick recap of what we covered. What burnout actually is. The 3 dimensions of burnout. Why burnout happens at work. Burnout or depression. Evidence-based ways to recover. And one small thing that really helps more people find this. Subscribe for weekly mental health explainers. Like this video if you found it helpful. Share it with someone who might need it.